Welcome to the MamasteFit YouTube page. In this video, we're going to be talking all about postpartum hemorrhage, what it is, and also signs and symptoms to look for within the first 24 hours postpartum to know whether or not you are potentially having a postpartum hemorrhage and when to seek help. So for those that don't know, I am Roxanne. I'm a labor and delivery nurse and student midwife and one half of the MamasteFit sister duo. And my name is Gina. I'm a perinatal fitness trainer and birth doula and the other half of MamasteFit. But Roxanne will primarily be talking in this video all about postpartum hemorrhage. And in Roxanne's most recent birth, she actually had a postpartum hemorrhage. And so she's going to share about her own personal experience and also for medical expertise. But just as a side note, this video is not medical advice. If you are seeing any of these symptoms, please talk to your medical provider. This is all just for educational purposes only. So postpartum hemorrhage is the #1 cause of maternal mortality in the U.S. So it's really important to kind of understand what it is and how can we prevent and treat it. So postpartum hemorrhage by definition means you've lost over 1,000 mLs or milliliters in blood within the first 24 hours. Most of that is usually going to occur at delivery. And this can be for vaginal deliveries or C-section deliveries. But we are not going to wait until you've lost 1,000 mLs of blood before we respond to it because we don't want you to get to that level. We're going to respond a little bit earlier. During vaginal deliveries, they might start to respond earlier than they would during a C-section delivery just because a higher blood loss is a little bit more expected out of a C-section delivery than a vaginal birth. So what are the causes of postpartum hemorrhage? There are 4 main causes, and we call them the 4 T's. So the first one and most common cause of postpartum hemorrhage is tone. So it has to do with your uterine tone. Our uterus needs to contract after we have a baby. And if that uterus is not contracting, the wound that was on your uterus where your placenta was attached to is just bleeding because that uterus is not contracting down. When the uterus is contracted down, all of the blood supply is cut off to that wound, so it's not continuing to bleed. But if your uterus, again, is not contracting down, or not able to contract down for different reasons, then that would be a reason we need to intervene, whether it's because something's in the way. So maybe the placenta hasn't fully come out. So they need to go in and take out the placenta so that the uterus can then contract. If your bladder's really full, this also prevents your uterus from contracting down. But it could also just be like maybe you had a really long labor. Maybe you were on Pitocin for a really long period of time, so your body is not able to send enough oxytocin to that uterus to cause it to contract down. So we have other medications that we can give you to treat this. And these are the most common postpartum hemorrhage medications that we're going to give. So they're called uterotonics or uterus contracting medications. The first one is Pitocin. So if you've been getting Pitocin your whole labor, giving it postpartum as a first-line medication may not be the best option because your uterus is probably flooded. But if you haven't been getting Pitocin really during your labor, getting Pitocin can help cause your uterus to contract in the postpartum. Other medications are called Hemabate and Methergin, have different contraindications. So these are medications that you cannot give with a certain condition. So Hemabate you cannot get if you have asthma, and Methergin you cannot get if you have blood pressure issues because it can cause issues with your blood pressure. So we don't want to give that to you if you already have blood pressure issues. And then the third medication that we can give to you is Cytotec. So Cytotec is a uterotonic and can cause your uterus to contract down. It's also a medication that they can give you for an induction, side note. And then a more common medication that they're giving now during postpartum hemorrhage is TXA. And this is just kind of helps your body clot more. So this is not a reason, if the reason of your postpartum hemorrhage is tone, TXA is not going to be like the first medication that they're going to give you to help with your uterine tone, but they will give it to you to hopefully cause your body to help clot so you're not continuing to bleed. The next T, and probably the second most common T, is going to be tissue. So there is some sort of retained tissue inside of that uterus that's preventing it from clamping down. And usually it is the placenta. They're going to have to manually go in and remove any tissue that is still inside of the uterus. And it's not a comfortable procedure if you do not have an epidural. Sometimes they even have to go back to the OR. If you were a vaginal delivery, they'll have to take you back to the OR to do a D&C where they're kind of like scrape out anything that is remaining if they can't get it out with their hands. The third reason, the third T, is trauma. So babies come out of the vagina and they cause trauma to the perineum, the pelvic floor, the labia. There's different places that they can cause trauma. And the only way to stop bleeding at those sites is to repair those sites. So either by suturing it or applying pressure onto the perineum or the lacerations can cause the bleeding to stop. So the only way that they can stop that bleeding, again, they're giving you all of these medications, is not going to stop that postpartum hemorrhage. The only thing that they can do is repair it to get that bleeding to stop. And then the fourth cause of a postpartum hemorrhage is what we call thrombin, or this is just like your clotting factors. So something's going on with your clotting factors. You don't have enough platelets or you don't have enough clotting factors to help your body clot. And then this can cause just like profuse bleeding all throughout your body because your body has used up all of its clotting factors. So this is a condition called DIC. And this would be an emergency where we need to give you a lot of blood to kind of replenish those clotting factors and platelets. And it is a bit more of an emergency, but it is the least common reason for a postpartum hemorrhage. Number one reason, just to recap, is tone. Your uterus is boggy, is another one that they'll call it, or it's just not contracting down. And they need to get that uterus to contract down to stop the bleeding. The second most common is retained tissue. So most likely your placenta, they just need to go in and scrape it out. The third one is trauma. So perineal trauma, it could be a cervical laceration or like a deep vaginal vault laceration that is just continuously bleeding that they can't get to and repair quickly. And then the last one is thrombin. So clotting factors or low platelets are causing your body to not clot.
So what are some signs and symptoms that someone can be looking for within the first 24 hours that they are potentially having a postpartum hemorrhage and they should seek help?
A postpartum hemorrhage can really occur anytime within that first 24-hour period. This is like the highest risk time. But most of us, if you are going to have a postpartum hemorrhage, is going to occur either immediately after birth or within the first 1 to 2 hours. But signs to look for if you do have what we call a delayed postpartum hemorrhage later in that 24-hour period is if you're starting to saturate a pad in 1 to 2 hours. You should never be bleeding so much that you're saturating a pad, like you dunked it into a bucket of water and it's like soaked with blood in less than 1 hour or really less than 2 hours in that postpartum period. So if you start passing any clots, really anything bigger than a golf ball, but particularly anything bigger than an orange or a grapefruit-sized clot, please let your nurse know to notify them that potentially you might be having a postpartum hemorrhage. Another thing that we can look for is postpartum cramps is normal. We're probably all going to feel some sort of postpartum cramps because that is our uterus trying to clamp down to stop bleeding. But if you are having like excruciating postpartum cramps, or like it almost feels as if it's labor pain type cramping, that could be a sign that there is something inside of your uterus, like whether it's a clot or retained placenta, that your body is trying to get out by contracting pretty much. So if you all of a sudden start having a little bit of increased bleeding along with really, really, really painful cramps, that can also be a sign that you're starting to have a postpartum hemorrhage. And please call out for help if you start to see that.
If you've had a postpartum hemorrhage, what are some typical signs or symptoms that someone may experience that is not necessarily an indicator of an issue, but just something for them to be aware of as they're healing postpartum?
Yes, and that's a great question. Postpartum hemorrhages, when you have one, you're losing a lot of blood, and a big part of that is you're losing a lot of iron. So iron levels is what, like when you have low iron, you're really fatigued and lightheaded. You might have shortness of breath because iron is what makes our hemoglobin, and hemoglobin is what is transporting oxygen throughout our body. So if we don't have a ton of iron, we have lower hemoglobin. So our oxygen, it has to work a lot harder. Our body has to work a lot harder to move that oxygen around. So you're going to be more tired. So after a postpartum hemorrhage, you can expect to be very fatigued, short of breath for doing just the simplest things like walking to the bathroom. You might feel really lightheaded, dizzy, even faint really easily because, again, same thing, you lost a lot of iron. And another thing that I found myself is that I just wanted to sleep all the time. So like not just fatigue, like you just ran a marathon, but like fatigue where like you are exhausted from doing like one step. That is like expected. There are things that they can give you after a postpartum hemorrhage depending on how severe those symptoms are. Like if it's preventing you from going to the bathroom, like you pass out just walking to the bathroom, thinking about a blood transfusion can be something that might benefit you in the postpartum period. You might not need it immediately, like after birth, but maybe like as you're going throughout the day after having the baby within that first 24-hour period, if you notice like walking to the bathroom, like you passed out walking to the bathroom, maybe a blood transfusion can be a way to help you be able to function when you go home.
So we hope this video was helpful for you to understand one of the leading causes of maternal death, which is postpartum hemorrhage. So hopefully you understand what are some potential causes of postpartum hemorrhage, some possible solutions and treatments that your medical team may take, and then also some symptoms that you may experience to let you know that you need to ask for some help. And then if you do have a postpartum hemorrhage, sometimes you may not know that you had one. It may not have been clearly communicated to you. So understanding the possible symptoms that you may be experiencing after birth, which are not necessarily indications of an issue, but it could really affect your ability to navigate the postpartum. And you may feel very discouraged because going to the bathroom just completely wears you out. And you're like, oh my God, why am I incapable of surviving? And so know that if you do have a hemorrhage, it can be very normal to experience those types of symptoms. If you want to learn more from us on what to expect during birth and what to expect in the postpartum period, definitely check out our online courses. We have an online childbirth education course, which is completely self-paced. You maintain lifetime access of the course. It's closed caption as well. And then we also have a postpartum preparation course where we discuss the things that are going to happen in the postpartum period or could happen in the postpartum period, and also things to expect with your baby and things that you can expect to happen in the hospital setting. If you want to check out any of our online courses, you can use code YouTube10 to get 10% off any of the courses. And that's our little secret for you so that you can, because you watch this whole video. So thank you. If you enjoy this video, be sure to subscribe to our channel so you get notified whenever we release a new video. Go ahead and like this video and comment below if there's something else that you want us to break down about birth, postpartum, or anything fitness related.